So it's important to know the impacts of running on different terrains, from everything from tracks to trails, from uphill, downhill to concrete and grass. There's so many different implications for runners. It's important for clinicians to know and have good evidence behind recommendations, training suggestions, and to make sure that they can limit risk to injury. So, some really new research is coming out that's showing that uphill running is actually increasing tibial impact forces, while softer surfaces and downhill running actually lower the tibial impact forces. Now, on the other side, it's important to note that these downhill runners did have a higher cadence. There is a variability in runners as they run downhill. Some folks run with a much higher cadence, which is going to mean they have a lower flight time. They're going to have a quicker step rate. That's going to make it so they don't have as long of a stride length. That's going to help them decrease the impact forces. But when they did this research, they generally found that people running downhill actually had lower tibial impact forces than running uphill. But there's also muscular demands that are put on the body when we're running up and downhill and on different surfaces. Soft surfaces are going to demand more muscle strength for propulsion. Also, those softer surfaces are going to slow us down more when we're running on them. Also, it's important to note that running on a harder surface is going to be more efficient. There's going to be more efficiency and you are going to have less drag. There's going to be less braking forces. Also, that's going to come with higher impact. And then lastly, as we do look at some of these soft surfaces and uphill running, it's going to put a lot of muscular load on the ankle and on the posterior kinetic chain. So it's really important to think about these different aspects of running uphill, downhill on hard and soft surfaces. And one of the important things that we can see is this graph here, this infographic here of uphill and downhill running. So let's break it down and talk about the running gait first. So with increased step rate, with decreased stride length and flight time, you're going to have all that when you're going uphill. You're also going to have increased dorsiflexion, knee and hip flexion as well at initial contact. Think about running uphill. You're going to need more hip flexion to be able to just get your knee up higher and clear your foot over the ground. And then you're going to have more hip extension because the ground is further away from you, creating more of a hip extension angle. Also, on the downhill running, we talked about this, there's variability in step rate, flight time, stride length. Although most runners are going to be more heel strikers in this case, and they're going to have more knee flexion at mid stance. We're also going to see it's a decreased amount of hip and knee extension at terminal stance because we're not going to be able to get as much extension behind us. The distance isn't as far when we're running downhill. Now, let's talk about the muscular load or the load on the body. Well, we talked about tibial impact forces, so higher tibial impact forces when we're running uphill, generally lower tibial impact forces when we're running downhill. However, running downhill, we're going to have higher impact to the patellofemoral joint. This is because we are getting more of that pressure. We're going to have more load to the gluteals, more load to the quadriceps when we're running downhill. And actually, believe it or not, we're going to have a higher load to the calf as well. Think about how the calf crosses the knee. It's going to keep that knee extension, or it's going to keep that moment, that flexion from occurring, basically. So all those are important to note. Also, it's important to note that running downhill can have some implications when it comes to holding that eccentric load. We want to be careful because that repetitive stress can add up for patients over time. Now, running downhill, we also see a couple other implications that are important to note here. And one of those things is that there's variable terrain on hills. We have rocks, we have different angled surfaces. We didn't account for that in uphill and downhill running. We are just assuming these are flat surfaces going up, flat surfaces going down. Now, on the uphill side, we also talk about things like Achilles tendinopathy and medial tibial stress fractures. Those are going to be not indicated for going uphill. So if you have someone recovering from those injuries, it's not a good idea to have them go run up hills to start. And we also want to think about the Achilles load, the hamstring load. Proximal hamstring tendinopathies are going to be very much stressed in an uphill running environment. We have a lot of hip flexion, and we're going to have a lot of muscular load demand on it. So that's going to be compression forces, that's going to be tensile forces. So that's going to be a lot of pressure on those proximal tendons of the hamstrings. Also, the Achilles, we're going to be in a lot of dorsiflexion. That's going to cause there to be an elongated muscle and tendon relationship. That's also going to put a lot of stress on those muscles. We want to be careful. Not indicated for uphill running with Achilles tendinopathies recovering and returning to running. However, patellofemoral, you're generally in the clear going uphill. You're going to have less load here. So, what are some of the other implications, things that we can think of? Well, there's a ton of different implications, but I want to talk about running surface specifically. And running surfaces are really multifactorial. So here we have the surface and how soft it is. We can see as our surface gets harder, our stability gets less, or our stability gets higher. Now, as your surface gets softer, your stability gets lower as well. This is an important thing to think about when we are talking about the biomechanics of running on different surfaces. Now, before I go any further here, I do want to point out that there is a lack of research and a lack of good quality systematic research on different environments that people run on and how firm and how stiff they are. Grass, it can be long grass, it can be short grass, it can be hard packed, it can be dry, it can be wet. Tracks can be very worn, they can be new. Gravel can be loose or it can be really dense. Dirt, same thing, really packed or it can be more generally loose. Asphalt and concrete don't tend to change that much. So when I'm saying this, I am also saying this with a little bit of a grain of salt. Because while generally we're seeing across the research that grass, track, gravel, dirt, asphalt, concrete is kind of the order we're seeing things, and some folks include things like sand and wood chips, even softer than grass, but I kind of cut it off at grass just for demonstration and educational purposes. However, it's important to note here that unfortunately, we just don't have really good testing and good research here. This is the best information we have, and we want to apply that to our runners. The thing that we can apply is we know when surfaces are softer, it's going to be less impact forces. We know when surfaces are harder, it's going to be higher impact forces. But believe it or not, it's the same impact no matter what. It's just spread out for a longer period of time. For example, your soft surfaces are actually going to be the same overall impact. It's just spread out for a longer period of time because it's more gentle. Whereas your concrete surface is going to be a harder, more abrupt peak impact force, but you aren't going to get it for as long of a time. There's another thing to talk about here as well, and that is running economy. So when you're on a softer surface, you're going to land on the ground. It's going to have a higher braking force, which means it's going to slow you down more. It's going to slow you down in that initial contact mid-stand stage. Then when you go for propulsion, you want to think about the fact that you are not going to be able to push off from that ground as well. Think about running in sand, very loose sand. It's extremely hard because it has so much give. It's so unstable. So with those patients, you want to think about how that's going to play into a patient's recovery. Let's say a patient has a plantar flexion or a gastrocnemius strain that they're recovering from, Achilles issue. You want to be pretty careful about having them go run on grass, especially plantar fasciitis. Running on sand is one of those things that we really don't recommend. So we want to be mindful of that surface and how stable it is to push off from. Now, towards the concrete side, it is more efficient, but that comes with a cost of impact. So early in the training cycles, early when people are in training cycles for a race or for a marathon or maybe a goal they have in mind, you might want to get them on grass. It's going to help them lower the impact forces when they're most susceptible to an impact-related injury like medial tibial stress fractures. Then what you do is you also use that grass to your advantage. You're going to then help all the muscles get stronger because they are being pushed off a less stable surface. On the opposite side of things, you use that concrete more towards race day. It's going to mimic the conditions that they're most likely going to undergo. And also it's going to be the best mimicking, the best efficiency. It's going to help fine tune everything. And then the last thing that's important to think about as well is just that stability in terms of the medial lateral stability. So those patients recovering from an ankle sprain, or maybe they have chronic ankle instability, grass, gravel, a unstable dirt path with a lot of rocks or a lot of different features in the ground, it's going to be a risk for them to go run on those things. They could sprain an ankle, they could have a lot of instability problems. Same thing when you have knee or hip instability as well. Think about just a path that's slightly tilted. It's going to be harder for those patients to adjust to that because they just don't have as high of a stable surface to run on. All this being said, this is a good starting point to talk about. We can talk to our runners and advise our runners on the different benefits and downsides to running on grass versus running on concrete. The last thing you'll hear patients say, and this will come up quite frequently, is patients will ask you, they'll say, well, don't people just adjust to running on grass? Don't people just adjust to running on concrete? And 15, maybe 20 years ago, that was a theory that was out there, that essentially folks would adapt to their running surface and that the impact and load would stay the same. We're not really seeing that anymore. We're noticing a change in the research, especially with better data collection tools and better information out there. So we're stepping away from that, but that is a theory that is still circulating out there. I hope that information helps to help guide runners on uphill, downhill, and also running surfaces, and helps guide patients and avoid injury and improve training.